Many women can relate to experiencing painful menstrual cycles that are often dismissed, even though a recent study conducted by Professor John Gillibord reports that period pain can be almost as bad as having a heart attack. Women's gynecological healthcare in South Africa is a critical subject, yet it remains often overlooked, with many women across the country navigating life with conditions such as endometriosis, polycystic ovary syndrome, adenomyosis, and fibroids, conditions that can be debilitating, yet remain chronically under-researched and underdiagnosed. Citizen Cam took to the streets of Johannesburg to speak to women on whether they feel that the healthcare system is meeting women where they are, from experiencing long waiting periods to receiving a diagnosis, a lack of access to professional advanced diagnostic tools, as well as the financial and emotional toll these conditions can have.
I don't think we're quite there as a society, but I do think that as a global society, especially, we are becoming more and more aware of women's reproductive issues and gynecological issues, and are starting to make provision for it in policies, I believe.
My first visit at a gynae was in 2020. Prior, I had period pains. They were just abnormal, and I used to skip school a lot. And then just got to a point where we thought, let's go check this out. And luckily I had a medical aid, so it was easy for me to get some sort of access to a gynecologist. And we ran some tests. They had to do a lot of checking. And that's when they found out that I have endometriosis stage 3. And then I started treatment. We didn't really have like a specific treatment that we went for. We had to try from treatment 1 to 2, and that's money being spent into that. So with changing treatments, it also means that I'm constantly adjusting my body to one thing and another. I'm now also looking into traditional healing to try and see how I can deal with the symptoms. I feel that there are a lot of challenges to it, geographical challenges. You have women that come from, places where clinics don't have enough medical equipment to help with that. There isn't enough medical staff. You also have, the financial side of it, where it's just not easy. If you don't have access to medical aid, you have to get that treatment cash.
I don't think that there's enough research into women's gynecological conditions or reproductive health, because it takes on average between 7.5 to 11 years to get a diagnosis. I do feel like women are often dismissed most of the time because periods are apparently supposed to be normal, and they only care when it's time for you to fall pregnant, because one of the prominent symptoms of most gynecological conditions, endometriosis, polycystic ovary syndrome, and adenomyosis, is infertility. So only when you want to have kids, they start caring about it. Apart from that, you're given painkillers, you're given birth control, which has its own crazy side effects.
Women's health is one of the under-researched, underfunded, and understudied areas of medicine. Yes, we have made progress in the last decade, but even with us having made progress, we are still lacking in terms of meeting women's critical healthcare needs. So menstrual health is not just a health crisis, it's a public crisis. And I think the government workplaces need to incorporate menstrual health policies into their workspace policies, into national policies, to accommodate women. Pregnant women in the workplaces need to also be considered when these policies are being made. Antenatal days shouldn't be taken away from your annual leave days, and We just need to advocate for women in workplaces and in the country as a whole. Because when we have healthy women, functional women, we're building healthier societies. They themselves can also contribute towards the economy of the country. Most of our consultations, you find that adolescents are afraid of coming to the gynae. They do not know reasons why they need to see a gynae. And when we see women in their mid-20s, in their reproductive years, most of the time it's because they're struggling to conceive. But they won't consult for things like bad period pains, heavy bleeding, or irregular bleeding, because unfortunately society normalizes bad period pains, irregular bleeding, abnormal cycles. We just normalize the pain and say it's just part of being a woman. So unfortunately, when we see women, it's because they're either struggling to conceive, and unfortunately what society does is they pass the burden on or the blame onto the woman, and that's why we see women in their mid-20s.